Hello. So my name is Neylan Visnius. I'm here from Warren Wilson College to talk about a project that some colleagues and I have been working on recently around the intersections of food insecurity and non-medical interventions in Western North Carolina. And our project, I will admit, is still very much in progress. So I'm going to tell you about what we've done so far and what we would like to do, but some of our conclusions are not completely concluded yet. But probably the first thing that you're really wondering about is what is a non-medical intervention, and I'm going to get to that. But first, I've got to introduce you to a really exciting new Medicaid spending program that's been launched in North Carolina, and that is called the Healthy Opportunities Pilots, also known as HOP. This is a program that was launched by the North Carolina Department for Health and Human Services early last year, and it's a really cool Medicaid spending program. And the reason, or what its intended purpose is to test and evaluate the impact of providing select evidence-based non-medical interventions related to housing, food, transportation, and interpersonal safety and toxic stress to high-needs Medicaid enrollees. And the reason that they launched this program is that we found that about 90% of healthcare spending in the US is on medical care, so that's doctor's visits, pharmaceuticals, dialysis, emergency room visits, and those sorts of inside of a medical facility, that kind of care. But we know that healthcare and having good access to healthcare is actually way more complicated than that. And around about 80% of a person's overall health is driven by other social and environmental factors, and we refer to those as social determinants of health, or SDOH. And so what I'm getting at here is that a non-medical intervention addresses social determinants of health. It's usually an action to address one or more of them in order to reduce the amount of money spent down the line on medical care and to improve a person's overall health and quality of life way early on. Because medical interventions are often expensive, they're stressful, they can be really traumatic for the person who's experiencing them. And so we're trying to essentially, what the program is supposed to be preventative care that nips problems in the bud before they become an issue that's taken over a person's whole life. And so, in order to be eligible for HOP, a person has to be enrolled in Medicaid already, so that's a basic requirement. And then from there, they have to have at least one state-defined health criteria and at least one state-defined social risk factor. And a health criteria is a pretty vague, broad category that can range from anything from chronic kidney disease to diabetes to obesity. It can be asthma. Some pregnant women qualify if they're pregnant with twins. Some babies qualify if they're in neonatal care. Some children qualify depending on what their risk factors are. And then a state-defined social risk factor is screened for using this questionnaire. You're seeing a screenshot of one of the question sections, and those 4 sections, as we saw earlier, are food, transportation, housing, and interpersonal safety. And so you'd be asked a question like, within the past 12 months, did you worry that your food would run out before you got money to buy more? And depending on how you answer those questions, you may be deemed eligible for HOP. And a person, in order to become an enrollee, either has to be identified as being eligible by somebody within the health insurance company. There's one person who's a care manager for hundreds of people, or they can call a number on the back of their Medicaid card to get themselves screened. But it is an active process. They either have to seek out enrollment or be found through the system. And so the way that this program is organized, we have 3 regions in the state of North Carolina. They're outlined there in colors. The text is probably pretty blurry. But each region has a network lead, and that's a larger orchestrating organization that does distribution of funds and then organization of a network of human service organizations, or HSOs. And those are the organizations that are actually providing services to enrollees on the ground. So they're like food banks, housing projects, that sort of thing. They're usually already established in a community and providing some sort of service to people, and they're getting extra funding to launch programs through the HOP program. So, for example, in our Western region, our network lead is Impact Health, and then the group that we've been working on for this project specifically is Bounty and Soul. They are a food justice organization. They do all the things that you might expect a food justice organization to do, which is like distribution of food goods. They work with local farmers. They have nutrition education programs. And then with the HOP funding, they've been able to expand and start this new program specifically for their HOP enrollees, where they're designing meal plans that fit the nutritional requirements of certain health conditions, and then making those meal plans really easy to follow, simple recipes, like agreeable to a majority of people, and sending out boxes full of groceries so that people can like keep up with those meal plans as like easily and conveniently as possible. We're trying to make good nutrition accessible, essentially, is what the program is getting at. And Bounty and Soul has had a lot of successes here. They've been keeping up with 30 to 40 households every week. They're developing really flexible meal plans to meet a variety of people with a variety of needs. And they're serving like a pretty large geographical area for a place that only has one like brick and mortar office. So they're working out of Black Mountain, North Carolina. That's where that little line is pointing to. And then they're serving all of Buncombe, McDowell, and Henderson counties. And they've been doing this for a couple months now, since 2022. But they've also had some hurdles, as you might expect. One of them is just like the basics, like scaling up from the few households that they started with to the 30 or 40 that they're working with now. So that's all the planning, all the boxing, all the deliveries. And then two, which is also listed as one here for reasons I don't actually know, is getting eligible people enrolled in the program. In a lot of cases, they have, and this is actually true for a lot of the human service organizations within HOP, they have money and they have resources for people who aren't in the program because they might not know it exists, or they might be having trouble getting enrolled, or for whatever reason, like they have the qualifications and they meet the eligibility requirements, but they're not in the program, so they're not getting the resources that are technically allotted to people who would be them. And so that's where we come in as researchers. We are 3 student researchers and 2 faculty advisors from Warren Wilson College, right outside of Asheville, North Carolina. Our advisors, David Abernathy and Holly Rawson, got a grant from the South Big Data Hub to fund our research. And we are working to use geospatial data and statistical analyses to identify places within our given counties where Bounty and Soul could focus outreach efforts to get more people and extend the reach of their program as broadly as possible. And so we've been using 3 main data sets in this work. The first one is the CDC's Places data set, local data for better health, and then the CDC's Social Vulnerability Index, the USDA's Food Access Research Atlas, which we've just been calling the Atlas, and then everybody's favorite US Census cartographic boundary files we've been leading on pretty heavily. And a lot of our initial work was just like figuring out how individual variables were distributed throughout our counties. So for example, here you can see the census tracts within all of our 3 counties ranked by percentage of persons age 25 or older who are lacking a high school diploma. This was a variable that Bounty and Soul specifically asked us to look into because they were finding that a lot of the people they were serving, for one reason or another, were unable to complete their high school education, and it put them at a disadvantage. And so they were having more trouble getting the things that they needed to take care of themselves. And so, like, you can see things in darker blue indicate a higher percentage. McDowell County, which is over on your right, has a lot more of those dark blue tracts. There's a little bit in Henderson County, which is down there on the bottom, and then up in western Buncombe County, we have some of those darker blue tracts. And then from there, we started working on our more like fleshed out projects, and a lot of that has meant clustering. So we're narrowing down places of interest for our outreach, right? And so we're looking for clusters of health conditions and clusters of social and environmental factors because we're trying to find places that are likely to have the highest percentage of people who would be eligible for this program. And so we started with health clusters. We did a lot of this work in R and then mapped it in QGIS. So for example, here, Grayson did a lot of the R work and analyses to make the clusters, and then I mapped it in QGIS. And we included 8 conditions in our clustering here. I'm not gonna make you listen to me read them all out, but they are listed on the screen. And we chose these 8 because they were ones that Bounty and Soul had indicated an interest in. They're things that they're seeing frequently, or things that they're like one of the meal plans that they're working on most often. And what happened was our clusters actually came out essentially ranked from high to low. So you can see the dark areas are places that across the board have higher percentages in each tract of all of those conditions. This is all places data, so it's by percentage of people in the tract who have a certain condition. And then like the lighter colors have lower numbers across the board for all of those conditions. And we thought, well, that's very interesting. We were thinking we might get clusters of some conditions and clusters of some conditions, not all of them all at once. And so Mason made a core plot. Here you can see correlations of disease across statewide census tracts. And he actually included a condition on here that was not included on the map, and that's cancer. And the reason that I point that out is that every single condition that we looked at was really strongly correlated with every other condition that we looked at except for cancer and except for high cholesterol. So you can see like stroke, chronic kidney disease, diabetes, COPD, heart disease, they're all really strongly correlated with one another. So where we find high numbers of one, we're likely to find high numbers of all of them. And so then we started looking at clusters of data from the Social Vulnerability Index. And the conditions included, again, are listed on the side. And once again, we ran the clustering in R, we mapped it in QGIS, and we found that all the clusters were ranked from highest to lowest across the board in all the conditions. And again, we're seeing some areas in McDowell County that are darker purple, some areas in Henderson County that are darker purple, and then unlike the health clustering data, we're seeing a couple points in the middle of Buncombe County that are highlighted for having overall higher numbers of these social vulnerability factors. And so we were like, cool, time for another core plot. And as you can see here, this is a core plot that Grayson made. There is literally nothing in here that is negatively correlated with anything else. So all of our factors were pretty highly correlated with one another, and especially like the one that we noticed the most was below poverty. So below poverty was highly correlated with crowding, unemployment, lack of a high school diploma, not having a vehicle, being a single parent, being of a minority, or being disabled, which like shouldn't really be a shocker. But it was interesting to find that all of our clusters were ranked in this way. And so we did those clustering, we did those maps, we did these core plots, and then we thought, you know what we really need is a bigger core plot. And so this is a lot of colors and a lot of numbers. So I'm gonna point out the things that we thought were interesting. This is a correlation plot that Mason made. It does include cancer, which was not in the maps, and it does include some social vulnerability index factors that were not in the maps. But what I thought was interesting when I was looking at this is everything in darker purple are things that are negatively correlated, and you will see that median family income and per capita income are both negatively correlated with pretty much every single health condition except for cancer and high cholesterol. And then on the flip side of the same coin, per capita income, no high school diploma, below poverty, those are all things that are positively correlated with every condition we looked at except for cancer and high cholesterol, which basically boils down to wealth and health being correlated with one another. The more money you have in a tract, the less likely you are overall to have high percentages of conditions that would be affected by your ability to access good health care, to access healthy nutritional options, to access any of those things that we know are really important for a person or a tract or a household to be resilient and have the things that they need in their lives. And so that was pretty much, that's as far as we've gotten on our clustering work so far. What we'd really like to do going forward is have some non-correlated variables in there to see if there are interesting distributions of some factors over other factors, but that will be in the next phase of our research. Another project that we've been working on, though, came about when our advisor, Dr. Abernathy, recommended this report from the Institute for Local Self-Reliance. And essentially, it's talking about dollar stores and how dollar stores are becoming more and more prevalent across the country, and they're especially becoming more and more prevalent in underserved parts of our country. And one of the things that they found that we just thought was like an interesting off-the-cuff number is how Whole Foods across the country sells way fewer groceries than dollar stores, which shouldn't be shocking just from the fact that like there are tons more dollar stores than there are Whole Foods. But we did wonder if it would be interesting to take our dollar store data and use it as part of the way that we pinpoint areas for Bounty and Soul to focus outreach. And that has been my pet project recently. If you'll remember from when we were talking about geocoding just the other day, in that first session, I spent a really long time geocoding by hand all of the locations of grocery stores in our 3 counties and all the dollar stores in our counties. And grocery stores, like quantified as like a store that would have a large, extensive produce section, because dollar stores often have frozen goods, they often have dried goods and canned goods, but they don't always have produce. And if they do have produce, it's often like this much. They have some berries. And so grocery stores included Ingles, Food Lion, Whole Foods, Walmart, that sort of thing. And then the dollar stores are Family Dollar, Dollar Tree, and Dollar General. And we've just been looking at these in terms of numbers right now. So starting with population, just to get a sense of size of county, which you can kind of see just from the size of Census Tract. Buncombe County in pink there, 270,000 people-ish. So that's our largest. In the middle, we have Henderson County. That's the green on that map, 116,000 people-ish. And then McDowell County, 44,000 people-ish. So Buncombe County is obviously larger than McDowell County by a significant amount. So as you would expect, they have more grocery stores. Buncombe County has 27 grocery stores, where Henderson has 9 and McDowell has all of 3. They're all located in Marion. You can see them in the very center up there in those little yellow dots. So they have, Buncombe County has 9 times as many grocery stores as McDowell County and about 6 times as many people. But for dollar stores, Buncombe County has 28, where Henderson and McDowell have 14 and 13. So while they have 9 times as many grocery stores, they only have twice as many dollar stores, which would indicate an overrepresentation of dollar stores in the McDowell County area. And we thought that was interesting, and we thought, what would happen if we put this in terms of ratios? And so Buncombe County has about 10,000 people, again, ish, per grocery store, and about 9,700 people per dollar store. Where Henderson has 13,000 people per grocery store and 8,300 people per dollar store, and McDowell County has 15,000 people per grocery store and 3,400 people per dollar store. So people in McDowell County have way more access to dollar stores than they do to grocery stores, and especially compared to Buncombe County, there's a lot more access to dollar stores and whatever a dollar store is selling in terms of groceries than there is in Buncombe County. And so the first thing that we've done with this, and what we would like to do more of, is overlaying, this is about as far as we've gotten, but overlaying that point data from our stores over some of our conditions, like our clustering maps. And so as you can see here, this is the health conditions clusters. Again, McDowell County has a lot of darker tracts. Henderson County has some darker tracts in the east, and Buncombe County has some in the northwest. And we're just gonna start looking at what places have higher numbers of health conditions, higher numbers of social and economic disadvantages, and then higher numbers of dollar stores and lower numbers of grocery stores, because those are likely going to be places where there are people who are eligible for HOP, who need the program that Bounty and Soul is working on, and that are the best places to reach out to with this program that is intended to get in at health from the get-go and make sure that everybody in North Carolina has access to the things that they need to live healthy lives and be taken care of. And so moving forward, we would like to work on that correlating clustering with non-correlated variables. We're working on refining and summarizing all of the things that we've showed you so that we can talk to Bounty and Soul and get their feedback on what they might want us to do next. And then third, which we haven't been able to start yet, but we're looking into, is researching broadband access in the surrounding counties, because Bounty and Soul is hoping that part of their reach will extend to virtual education in the places where they can't actually deliver groceries, still making resources accessible. And I'd just like to say a big thank you to Bounty and Soul for working with us this whole time, to the South Bay Data Hub for the funding, to our advisors, David Abernathy and Holly Rawson, who wrote the grant and have been advising us the whole way through, and to my colleagues Grayson, who is here, and Mason, who is not, who did a lot of the work that you saw on the screen today. Cool. Yeah. Yeah, that's actually a good question. So they have, one of the things that we were looking at doing earlier that it turns out they didn't need from us was like ways to maximize fuel efficiency in their route, because it turns out that like one of the things they don't have a lot of funding for is actually the driving of boxes to places. And we were not able to get that data from them, similar to, we wanted to add Medicaid data into some of our maps, and it turns out that like they're kind of goosey about giving that out because they don't want to expose people's private information. Yeah. That's the Places data set from the CDC. Yeah, that's Places local data for better health. They have, actually they also have other geographic units aside from Census Tracts, including zip code and block group. I don't actually know. So HOP is currently, it's a 5-year pilot program. And so like, not only are all the HSOs like rushing to prove that the work that they're doing is important, but they're also, this program is only lasting 5 years. So right now they're only focusing on those regions. And then if it's successful, maybe there would be expansion, but it's not clear yet. They're only in about year 2. Yeah. Yeah, that is Grayson's favorite thing in the whole wide world. We have had trouble getting data for that so far, and it would be something that we would like to look into. Yeah.
So kind of on just the data question.
Mm-hmm.
What other data sources do you all wish that you had access to, or if they exist or might not exist yet?
Yeah, the transportation data would be really helpful. We would like to have access to like number of Medicaid enrollees per census tract. You can get it per county, but we couldn't find a way to get it in census tract numbers because you're like at risk of exposing people, we think is the reason that you can't get that. But that would be helpful when we're overlaying like the health cluster and the social vulnerability cluster data in terms of like finding places where there are higher concentrations of people who like could be eligible for HOP. It would be nice to have lists of community organizations that we could reach out to about like putting flyers up and having informational meetings and stuff. But that would be like requiring like more intensive searching. All right. Thank you so much.